No amount of herbal medicine can melt what you are seeing. A lot of women are being deceived that this thing you are seeing can melt. This medicine can melt this medicine. No, it is not medically proven. And this thing you are seeing here is fibroid, and it is very common in African women. Factors such as early menstruation, obesity, family history, amongst others, exposes you or predisposes you to this fibroid. And it is normally believed that women who don't get pregnant or women who have not been pregnant before, omutanya this fibroid. It is not true, but there is a slight explanation to that why people think or researchers think it is so. In the womb or in a woman's body, there are these two hormones, which is estrogen and progesterone, and they are responsible for our menstruation, our ovulation, like anything concerning the woman's body. These estrogen and progesterone are responsible for that. And once you reach your reproductive age, that is in your 20s to your middle 40s or late 40s, there, these estrogen and progesterone are actively working in your blood. You'll be menstruating, you are ovulating all the time. You don't get pregnant. So almost all the time, these hormones are circulating every month, every time in your system. And when that happens, with time, these same muscles will form growths in the womb, and these growths will feed on this estrogen and they will become big, they'll start growing. But once you get pregnant, you kind of take a break from these hormones. So let's say for like 9 months you are not menstruating, you are not ovulating, obviously because you are pregnant. So these hormones don't get to ɔmo nya dwuma papa bi andi wɔ womb ne mu. The placenta, that is the what will feed the baby, takes over to produce the estrogen and progesterone to protect the baby, make the baby grow and all that. So the womb kind of take a break, and once you deliver to, the womb will shrink and go back to remodel itself and then go back to normal. But sometimes, even after pregnancy, because the placenta was producing large quantities of this progesterone and estrogen, it can even cause fibroids in the woman as well. So the thing is kind of dicey. Even if you have delivered 2, 3, 4, you can still get fibroid. If you have not delivered as well, you can get fibroid. So these factors predisposes you to getting the fibroid. That is family history. That is in your family. If you have people who have had fibroids before, there is a likelihood that you can also get fibroid. And then early menstruation. A lot of girls or ladies menstruate very early in life. Some at 12, at 10, 11, they've started menstruating. Those people too, because of the early menstruation, it predisposes them to getting fibroids later in life. But fibroids are non-cancerous, that is, they don't cause cancer and all that. So if you have fibroids and you are getting those signs and symptoms that is making life so difficult and unbearable for you, it is advised that you take them out, even though it may grow again because you are in your reproductive years. But when you attain menopause, this estrogen and progesterone ceases to prepare the womb for menstruation, for ovulation, for pregnancy, and all that, which causes these fibroids to shrink on their own. It affects individuals differently. Some people, it may affect you and it will not be so rapid, it will not grow so rapidly. So you can manage it, and then once you attain menopause, it shrinks on its own. Some too, the effects that it brings, the prolonged menstruation, heavy bleeding, the back pain, the all those things, it's unbearable for them. So it is advised they take them out surgically to be free. So that is it about fibroids. Don't forget to follow Nesbeka. Save this video and share it with a woman to create awareness. See you in my next video. Bye.